Hey guys, it is Dr. Dawn, Chicago's own board certified BGYN. I am here on my Facebook Live page and I am here talking to you guys about a subject that I see a lot. But first, let me tell you who I am. Again, Dr. Dawn, Chicago's own board certified OBGYN. My mission is to empower women with pertinent medical information and reproductive knowledge, reproductive health knowledge, so that they can empower themselves to and be motivated to do better for themselves. Um, I'm here every Thursday, usually at 12:30, but today I had to do something, so I'm here at 5:30. And I'm usually here talking about different topics that my friends or my family or my patients talk to me or ask me questions about. So today, what I want to talk to you about was vaginal discharge. Vaginal discharge is something that most women will be concerned with at some point or other. So I just wanted to talk about what it is and things you should look out for. Most of the times when women are coming into the office, they're asking me, is this normal? And if it's not normal, what can I do about it? So again, I am going to talk today about vaginal discharge, and we're going to talk about what's normal and what is abnormal. So with vaginal discharge is just a regular event that we have as women. And it's very responsive to our menstrual cycle, which means it's very responsive to the estrogen and progesterone that you have in your system. So you will notice more of it or less of it depending on where you are with your menstrual cycle, specifically where you are with ovulation. That's something that you may want to kind of write down or kind of figure out depending on what's happening if you're really into figuring out what your discharge is going to be or what you can anticipate. But normally, vaginal discharge is going to be clearish. It's not going to have odor. If it does have an odor, it's pretty mild, but it should be clear, maybe to white. It can be thick or thin, again, depending on where you are in your menstrual cycle. Specifically, whether you've ovulated or not. So if you are after when you've ovulated, it tends to be a little bit thicker. And then if you're before the time that you ovulate, it'll be a little thinner. But either way, it should really be clear, maybe white color. If it has an odor, it should be very mild. Most of the times you don't have an odor, and it really should be not too irritating to you, my ladies, that when you come in. Discharge is really kind of what we find in the vagina normally. So normally you'll have skin cells, you might have bacteria like lactobacilli, and you'll have glucose that's there. Because of those things that are there, you may have different bacteria. You might not even have a little bit of fungi there, but at a very low amount. Because of those things being there, you tend to be a little bit acidic with your vaginal secretions. So the pH of 4 is what we typically will see. 4, 4.5, that's what we kind of look at as being acidic, and that's normally what you will find when you are looking at the vaginal secretions that are normal. So one of the things that we will do when you come into the office is to kind of look at the pH of your vaginal secretions if you're coming in with something that's different or if you feel like you're having a problem. So what are some of the things that women will notice when there's a change? One of the things they will notice specifically is it may have an odor. It may be a little bit more pungent, a little stronger than what you would typically have. Sometimes it can smell really bad depending on what's going on. And normally I tell ladies if it's an odor that you typically normally have, don't get too worried about it. But if you notice it a little more pungent, sometimes we'll see fishy, then you might want to come in, especially if this is prolonged. The other thing we might notice is that it may be irritating. Even one of the main things people are concerned about is if it's itching, and the itching can be pretty severe. It's not this mild itching that we sometimes see. You can have some severe itching where you have to get up from where you are and kind of go have a private moment to take care of yourself. So again, when we find that we have some strong changes in that what's going on, that's when you want to come in and get checked out. So change in your odor, change in the color. Like I said, you can have clear, You can have whitish color that you notice, but if you notice something like a yellowish, it's a greenish, or if it's a brownish red, those are all reasons, especially if that's consistent, those are reasons to come in and be seen with your physician. Now, the other things that you want to pay attention to are what are some other symptoms that you're having with this change in your discharge? Specifically, are you having more pelvic pain? Are you having pain with sexual intercourse? Those are things that you want to pay attention to because those usually kind of go along with a certain thing happening, and the discharge is just an example of that. So what are we looking for? What are some of the things that we'll do when we have our ladies that will come in because of a change in their vaginal discharge? So typically I'll ask you little questions and I want to know certain things. I want to know where you are with your menstrual cycle. Are you on your menstrual cycle? Are you sexually active? If you're sexually active, are you using condoms? I want to know how long the discharge has been there. What's the difference that brought you in? So what's the odor? How is that different? Is it a change in the color? And then what symptoms you're having? Are you noticing pain? Are you having pain with intercourse? Or even something as simple as a tampon or whatever. If that's really painful and that's different for you, then that's something I need to know about. Then we're going to do a pelvic exam. So with the pelvic exam, we'll use a little speculum, and a speculum is a device we use to kind of place in the vagina so we can look at the vaginal walls and we can specifically look at the cervix. The cervix is at the top of your uterus, and that's basically the neck or the opening to your uterus. So we will take a look. I usually have to get a light, and I will take a look at the vagina, and I'll look at your cervix, because if there is discharge, then it will be very obvious. And it really depends on what I see. Sometimes I look and I don't see much. I might see some clear thinnish discharge. And I know we're really not worried. I'm not too worried about what I'm going to find. Typically, if there is something that's different, I'll see one or two things. I will see a thick white vaginal discharge. When I say thick, it's like curds that you see when you have cottage cheese, and that is actually something that we were learning as we were in med school. It's a cottage cheese like appearance, because that's what it looks like. And so you'll have this thick discharge. It's adherent to the walls. It's right there on the cervix, and it's the vagina is just a tube. So it may be pooling at the bottom of it. You have so much. So we'll take a sample of that just to either turn it into the lab or we'll look under the microscope. Now, I also might just find a lot of extra discharge. It could be yellowish, brownish, greenish. I might smell the odor. It might have an odor that I can smell. So a lot of times I will, again, take a sample of it. Because the vaginal secretions are a certain pH, sometimes I will add paper to it that lets me know the pH of it. So I'll put that there, and that'll let me know what the pH is. Sometimes we'll do what's called a whiff test. So we'll put the solution in, and if it changes with the pH and you have more of that discharge smell, then we're thinking one thing versus the other. So usually I'll put that speculum in, I'll take a sample, I'll take a look. I also want to see, are there lesions there? Are there ulcers that are there on the cervix or in the vagina? You might have lesions that look like small cauliflower-like warts or lesions, and they are genital warts. They don't typically give you a discharge per se, but if you have more of them that are in the vagina, if you have an intercourse, and then they're very delicate, so you have intercourse and maybe have some bleeding, you can have some bleeding that's there that could present as a discharge. So there's a lot of different things that could be present. So we're going to take a look to see what's there. Lesions, warts, or just the consistency of what that discharge looks like. So then typically I still will do a bimanual with that. And I also make sure that you're up to date where you are with the pap smear. So with the bimanual, again, that's for me to see if there's pain with the exam. So we do the bimanual, and I'm kind of feeling your cervix, and we move the cervix a little bit during the exam, and you're really uncomfortable, then I'm thinking a certain thing with that as well. So after we do the cervical cultures and I'm taking a look and then we'll do the exam, typically I will run the cultures, send the cultures, and I'll look under the microscope. So a lot of times when we are, ladies are coming in and the discharge and it is actually abnormal, we have a couple of things that we'll see. Sometimes we'll see a candidal infection or yeast infection is typically what people will call it. Sometimes we'll see what bacterial vaginitis that will cause ladies to come in. Sometimes we'll see sexually transmitted infections that cause a change in your discharge, vaginal discharge. So one of the main things we see is trichomonas. So trichomonas actually there's a certain look to trichomonas when I'm looking at that cervix. I kind of get a little hint of, okay, this could be a STD, or this could be specifically trichomonas, and that's where looking under the microscope will help me as a physician, because each one of those things, yeast, trichomonas, and bacterial vaginitis, they each look specifically different under the microscope. So, or again, I might look under the microscope and not see anything, the skin cells or normal things that you normally see. So let's say we're looking under the microscope and I see what we call hyphae or little buds. That's typically yeast, and that will correlate with that thick curd-like vaginal discharge that I see. So that's usually a candida or a yeast infection, and that's something that we see a fair amount of. The bacterial vaginitis, that has a specific look to the epithelial cells that we see. So we'll see the epithelial cells, but they'll also have bacteria that's on those cells. So clue cells are what we're looking for. And so when we see that, we're thinking more bacterial vaginitis, specifically if that discharge has an appearance that looks like that. With trichomonas, you actually will see the trichomonads in the discharge. So they are little they're not bacteria, but they are little organisms, and they have a little whiptail to them, and they're often kind of moving around on the microscope. So when we see that, we absolutely know that that's trichomonas. The problem, or one of the things that we see specifically with trichomonas, is that you might not have any symptoms. So you might have just a slight change in your discharge. You don't necessarily have a change in your odor. It might not change any colors. You might just have a little bit more of it that you typically see. So a lot of times I'll tell ladies about the trichomonas, and they're really kind of surprised because they didn't really have symptoms that you have with other STDs. So one of the things I'll look for, and we have to test for that because you can't necessarily see it on the microscope, is chlamydia and gonorrhea. So chlamydia and gonorrhea also look a little different. They usually will have a little color change, yellowish to greenish. Doesn't necessarily have an odor, but you will have more pelvic pain with that. So ladies are coming and they're saying, hey, I'm having more pain with intercourse, or if I do the exam and I find that they're really uncomfortable, more so than just being nervous about the exam, they're really in pain, then I'm thinking more with gonorrhea and chlamydia. So let's say I'm looking in the microscope and I see the yeast. If that's the case, I will treat you with an antifungal. So there are typically a couple of ways you can do it. You can do it either with a pill. The most common is the diflucan, or you can do an antifungal cream or a tablet that you'll put inside the vagina. Typically, you'll use it for 3 days, 7 days. There's some medications that you can use it for 1 day. And a lot of times, depending on what it is, it'll be either a cream or a tablet that you put in the vagina, but it's also useful to get some of that cream and put it on the outside, because that's honestly where a lot of ladies get most of those symptoms, is the labia of the vagina is really irritated. So I tell ladies that first day, get some of that cream and put some on the outside. So that's for the candida or yeast infections. With the bacterial vaginitis, we have to treat you with a specific medication with that as well. That one is metronidazole most of the times. Two ways you can do it. You could do a 1 dose, which you kind of take 4 big horse pills, or you can take a couple of pills for 7 days. It really just depends on the woman. Some ladies don't like taking pills, so I try to get them just to do the 1 day 4-pill shot, just be done with it. Some ladies are okay with taking it, so we'll do 2 pills for 7 days or so. What you have to really remember is that The pill kind of interferes with alcohol. It can make you nauseous when you're drinking alcohol. So if you are on the medication and being treated for bacterial vaginitis using flagyl, you want to be careful and not use alcohol while you're on that. So that is the bacterial vaginitis. Then we have the yeast. Those I honestly say are the top two that we will see. Trichomoniasis, you have to get a antibiotic for that. So you can either get a pill for that. It could be a 1 day or it could be over a couple of days. Usually it's a 1 day pill that we'll give you. Azithromycin or in that family. And then if you have gonorrhea, chlamydia, again, usually we'll give you a shot right there in the office, could give you a shot, and then you go home with some antibiotics as well. And if we find that these are sexually transmitted infections like gonorrhea, chlamydia, or trichomonas, we'll probably have you come back in a couple of weeks just to make sure that you took the medication correctly and the infection is cleared up. Because the thing with sexually transmitted infections or STIs is that you're sexually active. If you picked it up, you may not have used a condom, or maybe the condom wasn't working correctly. And so the problem is that you're sharing that with somebody else, with your partner. So you have to be careful that you are treated correctly. Specifically for gonorrhea and chlamydia, you really want to make sure you get treatment for that, because if that is not treated and it stays present in the vagina is hooked to the cervix, and that's hooked to your uterus and your fallopian tubes. So what happens is you can get pelvic inflammatory disease. Pelvic inflammatory disease is just a big infection that occurs. The problem is, again, you may or may not have symptoms, and so it can impact your fallopian tubes. The fallopian tubes being impacted can cause problems when you're trying to get pregnant. So you can set yourself up for that chronic infection causing scarring inside your pelvis. You can set yourself up to that scarring to kind of create problems for your fallopian tubes. And you can set yourself up for chronic pelvic pain. So you want to definitely make sure that you are getting treated for that, so that you don't set yourself up for PID, pelvic inflammatory disease, and have problems long term because of that. So that's pretty much it. You want to, and again, I will piggyback into that, is you want to make sure when you're sexually active that you are using protection. Either you're using condoms or you are in a monogamous relationship with the person who you know. You both have been tested, and you both are free of STDs. So that's kind of the talk for today. We talked about the vaginal discharge. We talked about what's normal. We talked about what's abnormal, when you want to come in, and then some of the treatments that you may see. I will tell you, with bacterial vaginitis and with yeast infections, they can be a little tricky. You may come in a couple of times. Sometimes with my ladies, it will take a treatment or two for them to really get symptom free. Some of my ladies, we have to do what we call suppressive therapy, meaning that they're on some type of therapy every week or every month, because it's just hard for them to really treat that infection. I see that more so with yeast infection as opposed to anything else. So definitely, hopefully this helped you guys a little bit. If this was helpful, do me a favor, share this video with your friends or family or somebody who you think will be helped with it. And continue to follow me. I am Dr. Dawn, OBGYN. I have a website, drdawnobgyn.com. And I am on Facebook, Dr. Dawn, OBGYN. I have a Facebook page. I am on Instagram, and I am on YouTube, all Dr. Dawn, OBGYN. So I'm making it very easy for you. And I also have a Facebook group that I am starting. It's been in place, but I'm getting more active with that. That is the Clever Girl Crew with Dr. Dawn. I am going to start putting extra information in there, so they'll have, question and answers that we'll do with the ladies that are in that group. So you want to join that group just so that you can participate, because that'll be more question and answers with me specifically when I'm in that. So thank you guys for coming on board and sharing your Thursday afternoon with me, and I will be back with you guys next Thursday, probably 12:30. Thanks.